Florence Nightingale was born in Italy in 1820. She came from a wealthy family. Her parents were well known and had many important connections. When she was a young girl, she loved reading and learning new things. She was very curious and always wanted to understand how the world worked. However, she was not interested in the usual activities for girls at that time, like drawing or playing music. Instead, Florence wanted to help others, especially sick people. She wanted to become a nurse, but her family did not think it was a good idea. In those days, nursing was not seen as an important job. It was not considered a profession for someone from a rich family. Her parents thought it would be better for her to marry and live a comfortable life. Even though her family was not happy with her choice, Florence decided to follow her dream. She knew that nursing was her calling. She worked hard to become a nurse, even though it was very difficult. At first, she faced many challenges. The training for nurses was not like it is today, and it was not respected by society. Florence trained in hospitals and learned all about medicine and caring for sick people. She worked with doctors and other nurses to understand the needs of patients. Florence became very good at nursing, and soon, many people began to notice her skills. She was known for her kindness and hard work. Her reputation spread, and she was invited to work in many hospitals. One of the most important moments in Florence's life came during the Crimean War, which started in 1853. This war took place between Britain, France, and Russia. Many soldiers were fighting and getting hurt. The hospitals were full of wounded soldiers, but the conditions in the hospitals were very bad. There were not enough doctors or nurses to take care of the soldiers. The hospitals were dirty, and the soldiers were suffering from infections. The hospitals were overcrowded, and many soldiers died from diseases, not just from their injuries. Florence heard about the terrible situation in the hospitals and decided to go to Crimea to help. She knew that something had to change. She took a group of nurses with her, and they arrived in 1854. When Florence saw the hospitals, she was shocked. The rooms were full of dirt, and there were not enough beds for the patients. The soldiers were lying on the floor. The nurses did not have the proper tools to help them, and many soldiers were dying from diseases instead of from their injuries. The conditions were so bad that Florence immediately knew what needed to be done. Florence knew she had to act quickly. She started to clean the hospitals. She made sure the rooms were washed and that the beds were clean. She also made sure the soldiers had enough food and water. Florence worked day and night, taking care of the soldiers. She was very careful about hygiene, and she believed that keeping the hospitals clean would help the soldiers recover. She also made sure the nurses were trained and worked hard to improve their skills. Florence set up a system to organize the nurses and make sure the soldiers received the best care possible. Florence's hard work paid off. The death rate in the hospitals dropped significantly. More and more soldiers began to recover from their injuries. Florence became a hero to the soldiers, and many people praised her for her dedication and care. She also became famous in Britain, and people started to see how important nurses were. Florence had changed the way people thought about nursing. She showed that nursing was not just about giving medicine, but about caring for people with kindness and skill. After the war, Florence continued her work. She wrote reports about what she had learned in Crimea, and she showed that hygiene and cleanliness could save lives. Her work helped to change the way hospitals were run all over the world. Florence's ideas were used in many countries, and she made a huge impact on the way people thought about health care. Her research and reports were carefully read by doctors and nurses, and many followed her suggestions to improve their hospitals. Florence also worked to improve the education of nurses. She believed that nurses needed to be well trained, so she helped create the first training school for nurses in England. This school was called the Nightingale School of Nursing, and it opened in 1860. It was the first of its kind, and it set a new standard for nursing education. Before the school was opened, nurses were not trained in the way we know today. Florence wanted to make sure that nurses learned important skills and knew how to care for patients. The school taught nurses how to be both skilled and compassionate. It also taught them the importance of cleanliness and keeping hospitals safe for the people who needed care. Florence's work did not stop with the hospital. She also worked to improve public health. She studied how diseases spread, and she used her knowledge to help prevent the spread of illness. Florence traveled around the country to learn about health problems in different areas. She worked to improve the water supply and sanitation in cities, which made people healthier. Florence believed that improving the living conditions of people could prevent many diseases. She taught the importance of clean water, proper sewage systems, and good nutrition. Florence's ideas about hygiene and healthcare were so important that they are still used today. Although Florence was very sick later in life, she continued to work. She spent much of her time writing and sharing her ideas. She wrote many books and reports on health and nursing. Florence Nightingale's work changed the world. She showed people that nursing was an important job, and she made hospitals safer and cleaner. Thanks to Florence, nursing became a respected profession, and many people's lives were saved. She inspired future generations of nurses to work hard and care for people with kindness and skill. Florence Nightingale died in 1910 at the age of 90. She was remembered as a great nurse and a woman who changed the world. Her work saved countless lives, and her ideas shaped healthcare for many years to come. Today, Florence is known as the founder of modern nursing. Many hospitals, schools, and organizations are named after her, and her legacy continues to inspire nurses around the world. Florence's work was not just about nursing. It was about caring for people, no matter who they were. Her life is a reminder that one person, with passion and dedication, can make a big difference in the world. Florence Nightingale will always be remembered as a true pioneer in healthcare.